Community Health Coordinator and Maternal Infant Health Program Coordinator, and McClure, and Public Health Nurse for Sleep Education and Fetal Infant Review Coordinator, Jeanine Quetant. Good morning.
Good morning.
Morning.
Wow, oh, we're out of time.
That's okay.
That's a mouthful. I'm interested to talk about this topic because it seems like things always change with infants and sleep, and you're always hearing different things and where you're supposed to put the baby in the crib, blanket, no blanket. Walk us through some of this stuff.
Well, it used to be that babies could sleep on their sides or on their tummies because they do sleep longer.
Right.
Well, that is against the babies because sleeping longer is also sleeping deeper. So we don't want the babies to sleep longer or deeper because they are less likely to wake up.
Oh, wow.
They don't arouse as easily when they sleep on their back.
Sure.
And
Really?
that's a good thing. Excuse me. That's a good thing because sleeping on the back is the safest way to keep the baby awake, to keep the baby to come back, wake up from their sleep.
Put them on their backs.
Yes.
Okay.
They don't sleep as deep. They don't sleep as long, but it's safest for them.
What about the blanket or fitted sheet and things like that?
So the reason why we want we go by the ABCs of safe sleep. A stands for alone, which means nothing else in the crib but the baby.
Okay.
2, B, the baby is on the back. And 3, the baby is on an empty crib.
No blankets.
Nothing.
Nothing.
No,
I can tell you, I was
no
not.
bumper pads.
I was not in an empty crib, was I?
No, you had Bluey, you had...
Bluey wasn't even invented yet, right? But I'm sure I had.
Yes.
Yeah,
plastic
I mean,
toys in there
from
with
our generation,
Yes.
we
Bumper pads.
and there were bumpers. We put
Bumper pads.
Yeah.
You could reach up and grab what were those things?
The Yes.
mobile.
The mobile.
Yeah.
Yes, and why shouldn't we have these things? Although the crib looks so beautiful. I remember my first child's crib. I showed everybody. I was so proud how beautiful the crib looks, but it was unsafe for my children.
Right.
Not to mention I slept with them on the same bed. and so the blanket can cover the baby's face,
Sure.
and they can breathe. It can strangle them, and they can breathe. And the pillows also, they can suffocate when they turn, if they were to turn for the very first time on their bellies, but they cannot come back, they will suffocate on that pillow. Even if they turn sideways on the pillow, they can suffocate. Bumper pad, same thing. They can suffocate against the bumper pad, and the stuffed animals, they can suffocate against them because they could turn for the very first time and can go back. So the stuffed animal can suffocate them.
Now you have 8 steps to keep your baby safe, and
Yes.
this is critical because a lot of these reminders, people, they're contrary to what, like you as a mom and me as a dad, when we were parents of little tiny ones, we didn't know all this.
We didn't know that, and I'm thankful for this because it's decreasing the amount of babies die every year from their sleep. So sleep on the back, of course, is because they breathe better and they don't sleep as deep, so they wake up from their sleep easier. And in their own space, that means the baby shouldn't sleep with the caregiver or the parents, because when the parent is exhausted, as they are when the baby is a newborn, and they easily sleep deeper than they should as a new parent, and they turn on the baby, roll on the baby. And another reason why baby shouldn't sleep on the parent's bed is that the pillows on the parent's bed, the blanket can cover the baby and suffocate the baby, and the baby can fall in between the bed and the wall, the mattress and the wall, and they are trapped. They can't come back, and the parents are sleeping, so the baby may not wake up.
So these, the incidents of SIDS, as an example of infant death where people, we don't know, could it be that it's because of certain factors that, like there's a blanket in there or there's a pillow in there that we don't know?
Probably so, but there are times that there's not much you can do about a baby's death. It wasn't prevented. And we are referring to when a baby is born premature, when they are born less than 5.5 pounds,
Okay.
underweight, and when they are low economic status.
Or if there's like a chronic health condition, and like if they're born with a
Sure.
congenital anomaly that, it's just not, something that could be prevented. But
Yeah.
sleep deaths are 100% preventable.
Wow.
And you offer some needs-based help. I know you guys have a pack and play program,
Yes.
but you offer help, and people can just call, correct, Ann?
Oh,
Yes.
absolutely. Yep, they can
Yes.
call the health department, and Jeanine and I work very closely together. I provide support to the FEMA program in addition to our maternal infant health program as well. So, our home visiting nurses and social workers in that program, we collaborate with Jeanine and provide that safe sleep education. And if there's a need for a safe sleep environment, we can give the family a pack and play.
Great.
Yeah, really, maybe you're going to have company that has a baby, they're not traveling, and I've seen this, we've all seen it. People will say, well, just put the baby on the big double bed,
middle of the bed, yeah.
and just put pillows around. That's
Not a good
no.
idea.
That's even worse.
Right.
Yeah, not a good
Yeah,
idea.
because
Not
the baby
recommended.
can be suffocated from both pillows.
Yeah.
Yeah. Basically, a baby shouldn't sleep on any other place except the crib, a bassinet if they are less than 15 pounds, and a pack and play if they are 30 pounds or less.
Now, I have an Apple. I've been monitoring my sleep the last couple of days, and I was concerned because I only had 7 minutes of deep sleep. But you're saying deep sleep is not good?
Oh, you
For
might-
the baby,
For the baby.
under
Baby
1
is-
year of age.
Yeah, you need the
Yeah.
deep sleep.
Because we want the baby to wake up from their sleep. We don't want them to die in their
Of
sleep.
course.
Yeah. Yeah.
So baby sleep like 12 hours.
They sleep a lot.
Yeah.
They sleep a lot, but whether it's nap time, whether it's night sleep, they shouldn't be in a car seat or a swing or
And when it's
all
time
of
to
these baby
eat,
devices.
if it's feeding time, you need to wake the baby up for feeding time, correct? In certain situations?
Sometimes,
Yeah.
that would be appropriate,
Right.
because infants need to eat every few
Yeah.
hours. So, and especially, they need to gain weight because fat is good for their brain development. So,
Yeah.
we want to make sure that they're being fed. You have really good information. I don't know if we have the infographic, but there's the anatomy.
Okay.
Yes. Oh,
'cause
yes, I do.
Historically, the idea was, well, if my baby's lying on their stomach and they spit up, they're going to choke.
Okay.
It's not physically possible because of
Okay,
the anatomy of the trachea.
So when a baby sleep on their back, I should have added that to
That's
it.
okay.
Oh, it's okay.
When a baby sleep on their back, if they spit, which is what people are afraid of, if they spit, they will choke. When they sleep on the back, if they spit, they do not choke because of the food and air tube anatomy. So this is the air, this is the food tube, this is the air tube, this baby is on the back. So you can see the food tube by gravity is on the bottom. By gravity, the spit will end up in the stomach because when the food tube goes straight to the stomach, bypasses the air tube. But if the baby is on their side or their belly, what happens is the air tube now is in the bottom. And so when they spit, by gravity, the spit ends up in the air tube, goes to the lung, and that's when they can die like that.
Well, I know you have all of these programs that are helping families with new babies, and the whole community can take advantage of all of your offerings. And all they need to do is give you a call.
Yes.
Yes. I don't know if you have our contact information, but I can say it. My number is 517-768-2114.
Awesome. Jeanine, how long have you been with the health department? Because it seems like we met about 10 years ago.
That was at Center for Family Health.
Ah,
Yes, I was doing a project, and they were helping me with resources.
awesome.
But I have been with the health department for 3.5 years. But the first 3 years, I was a COVID nurse.
Well, we're great to have
Yes.
you. We're grateful to have you here and
Thank
with the
you.
health department. Thanks for coming in today.
Thanks for
Thank
having
you.
us.
Anna McClure and Jeanine Quetant from the Jackson County Health Department. More of the morning show after this.